Hey guys, this is the Chapter 1 video. So if you can look at the schedule, you can see that we have Chapter 1 and Chapter 2. We're covering Chapter 1 and Chapter 2 this week. So this is the Chapter 1 video. It's the Dimensions of Wellness video. But before we get started, I just want to make sure that you are mindful of the due dates that are approaching. You have your syllabus assignment due on Sunday, as well as a student video introduction. Now, if you watch my previous video, the course introduction video, I gave you guys some visual instructions on how to complete the student video introduction, but then I also have some written instructions as well. So hopefully you'll figure that out. I see that I've received a couple, so I know you guys are turning them in, or you guys are seeing them. Let's see how many have turned in so far. If you go to the discussion board and you see, all right, so there's I need to delete this as a test. So there's 2 there, and another student emailed me. She hasn't been able to access her class yet, or the class yet. So I know you guys are getting the information, so that's good. So make sure you guys get these completed by Sunday. Okay. All right. So going back to the schedule. So as I mentioned, we're covering Chapter 1 and Chapter 2. This will be the Chapter 1 video. I'll be covering Chapter 1 lecture notes, the Dimensions of Wellness. So if you need to go back and review the notes, you have access to them right there in the lecture notes folder on Blackboard. Okay. Okay, so I need to delete this. This is from my spring semester. Sorry about that. All right, so when we think about health, wellness, fitness, all these terms, and this is a class, I'd ask you a question. How would you define these questions? I mean, these different topics. According to Webster's dictionary, you have health as historically has referred to the absence of disease. Now, so if this is kind of misleading, because right now, if you think that you don't have anything wrong with you, and most of you don't, with the exception of a couple of extenuating circumstances, you guys are 18 to 24 years of age. You really haven't had a chance to live long enough to develop any adverse health conditions. So you may think that you're healthy just because you don't have any diseases. But that's just kind of misleading. So we start to look at what does health really mean? Because if you live long enough and you really don't do anything to maintain your health, then eventually you're going to develop disease, and all of a sudden you're not going to be healthy. And and then that kind of leads to the next concept of, well, since I have a disease now, that means I'm not healthy. And again, there's lots of people who have diseases who, are still confident about their health. So when we think about the name of the course, Wellness Lifestyle, the term wellness is more of what we're trying to capture. We're trying to develop a sense of, how we want to live our life and what we want to experience with our life. So we will get into some philosophical concepts later on. We talk about morals or values or purpose and meaning in life, but that's not going to be the entirety of the course. What I'm trying to do is trying to give you a sense of everything that's involved in how confident you are about your health. Okay, and that's why we have this term wellness. You can see here, wellness, according to the World Health Organization, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, again, we think of health. Lots of us think of health as just simply, well, I don't have any disease, I don't have any injury, I'm free of any discomfort, therefore I must be healthy. But even those individuals may not be as healthy as we imagine. So wellness is more of an approach. It's more of a commitment. It's more of a plan. It's more of a strategy. of how we're going to not only stay healthy, but also stay healthy free, or disease free, or live as healthily as possible, or as healthy as possible for pretty much the rest of our lives. All right, so it's more of a strategy, it's more of a commitment. Okay, what I have here, this is called the wellness continuum, or the illness wellness continuum. Okay, and you can see that it has two ends of the spectrum. Yeah, I think I have the cursor there. So you can see on one end, you see that it's premature death, and then on the other end, you have the high level of wellness. Okay, so you can see the two ends of the spectrum. And then right in the middle, you have the neutral point. Okay, so pretty much, so when we're born, we're obviously born in the neutral point because we haven't lived long enough to develop any adverse conditions, and we haven't really, learned how to engage in a commitment to being healthy or living at an optimal level of health. Okay, so for the first 18 to 20 years of life, you're pretty much at a neutral point. You really haven't had a chance to go in either direction. If you live long enough, you start to develop some signs and symptoms. You're starting to, experience a different level of physical feelings in your body. Starting to, develop some pains or whatever. And at the same time, you also have an opportunity to go in the other direction as well. So let me walk you through this illness wellness continuum to kind of explain, what's going on here and then how it relates to this course. Okay. So let's say, between the ages of 18 and 24, you decide, or you start to engage, not necessarily decide, it just becomes more of a habit or routine that you start to engage in negative lifestyle habits. Now, whenever I say negative lifestyle habits, I mean anything that you can think of that's negative on a regular basis. Let's consider that. Let's say, okay, let's say you decide that you're not going to be an exerciser. You're going to live a sedentary lifestyle. You're not going to be mindful of the things that you eat. You're not going to be careful of your nutrition. You're going to be a smoker. You're going to be a drinker. You're going to be a drug addict. You're going to have unprotected sex. You're going to drive without a seatbelt. You're not going to, give yourself plenty of rest. You're not going to manage stress. I mean, anything that you can think of that would be perceived as negative, let's do it. Okay. Now, I'm not saying that that's the way you live, or that's the way everybody lives, but let's just, just for demonstration purposes or understanding purposes, let's do, the most extreme cases or case scenarios. Okay, so let's take someone who's engaged in nothing but negative lifestyle habits. Okay, so at first 18, 24 years of age, nothing really happening yet, but you continue, or this person continues, and then they start to experience some signs. They start to notice some signs. Now, what are some signs? Well, let's say they get their blood pressure checked and it's elevated. We'll talk about blood pressure later on this semester or this course. Normal blood pressure is about 120 over 80, and that's milliliters of mercury if you're looking at units. I'll talk more about what those numbers mean later, but that's normal. Well, if this person had their blood pressure checked, and let's just say they were in a medical clinic or at a hospital for whatever reason, because I don't think this person would actually go to a medical checkup. Maybe there was something going on and they had to go to the doctor. They had their vitals checked and their blood pressure, well, let's say it was 160 over 110, which is pretty high. It's pretty alarming. It's, especially if you're at rest in terms of you've been sitting down for a while and that's your blood pressure, that's a pretty telling sign that something's going on inside your body. Let's say their heart rate is, over 100 beats a minute. Let's say their blood sugar is over 126, 130. Their cholesterol levels are over 300. I mean, all of these are signs. You experience any of these signs, it doesn't necessarily associate with or changes in mood or changes in feeling. I mean, you don't know that your blood pressure is over 300. You don't know that your blood sugar is over, 140 or whatever it is. That you just, I mean, there's signs. It's an opportunity for this person to say, "Whoa, let me slow down. I need to start doing some things to kind of lower these numbers or to improve these numbers, because if I don't, it could lead to some further problems or complications later on." Okay, so that's our opportunity. So that's why we look at this as a wellness paradigm, because it gives us a chance to change directions. Whereas if we look at the treatment paradigm, all the treatment paradigm all it does is just gets us back to neutral, or as close to neutral as possible. So, for example, if you had your blood checked and it was your blood pressure was 300 over 300 milligrams of cholesterol per deciliter of blood, the treatment paradigm or the medical paradigm just says, okay, let's give this person medicine and lower their cholesterol level, and they get back to neutral. But the wellness paradigm is a different approach. It allows you to engage in a strategy, in a commitment to a different life. But I'll walk you down that path in a second. But for now, let's say this person decided to ignore all the signs. This person had all the signs that something's going to happen, or something's wrong with her, or could be wrong with her, but yet she decides, I'm not going to worry about it. I'm fine. I don't feel any different. I'm fine. So she continues, or he continues, to engage in all of these negative lifestyle habits, and over the course of weeks to months to years, eventually this person starts to experience some symptoms. Now, what are some symptoms at this point that they could be experiencing that could be a result of chronic lifestyle or lifelong negative lifestyle habits? There could be some pain in their chest, pain going down their arm. They could have pains, nagging pains at certain parts of their body, perhaps their elbows, their shoulder, maybe inside their leg or inside the side of their body. I mean, there's different things, chronic, or frequent headaches. These are all symptoms. Something that has happened that has kind of altered the way the body is functioning. The body is no longer functioning correctly. Now, can it still function with the overall movements and capacities? Sure, but now they're starting, this person's starting to realize or experience some limitations. And, but, again, this person has a chance at this time. You know what? I don't like feeling this way. I don't like having all this going on. I'm going to change my lifestyle. I'm going to start engaging in some positive habits. Or they can decide, you know what? I've already lived long enough. I'm just going to continue moving on. And they just don't change. They continue to engage in those same negative lifestyle habits. Now that I'm talking about this, start thinking about some of the people you know. I'm not lying. And this isn't that uncommon. I mean, this is, we see this. We look at our parents or our grandparents or our aunts and uncles or close friends or even friends of family members of other friends. We know of someone, by thinking back, they've been doing some bad things to themselves for a long time. And, now I realize or understand why they're experiencing, such discomfort, all the time. Oh, I have a headache, or, my feet hurt, or, something's going on to where, they could have avoided this if they just would have changed their ways, over the course of years or perhaps even decades. But again, let's say that this person just decides, you know what, I'm already halfway dead. Might as well just keep living life and trying to enjoy myself. And they don't change. They keep engaging in those same negative lifestyle habits. And they keep going down the premature death end of the illness-wellness continuum, the illness end of the continuum. And eventually, they start to experience some disabilities. So what are some disabilities that, people who have engaged in negative lifestyle habits for an entire lifetime start to experience? There's amputations. There's people who are suffering from diabetes. They have to have their toes amputated, their feet amputated, their lower leg amputated, all the way up to above their knee at times. Those are disabilities. I mean, there's no turning back. There's no coming back from this. You know, a disability could be, you had a heart attack. Now your heart doesn't function as well as it should be, or it's irreparable. Maybe you've had a stroke. Now you've lost function in certain parts of your body. These are all disabilities, and lots of times these are attributed to poor lifestyle habits. And this could have all been avoided. And lots of times, people know what they're doing. I would say that a lot of smokers, they know now that, smoking can be bad, but every once in a while, there's smokers that don't realize that. They don't know that yet. And, so they just keep doing this for whatever reason. They think they're cool, they're trying to fit in, whatever it is. And, they suffer because of, lack of awareness. People don't understand that, nutrition's important. And, I'm not saying that you shouldn't, or you should avoid any particular food. I'm not saying don't go eat pizza, don't go eat hamburgers. I'm not saying that. I'm just saying that know what's capable of happening, and moderate yourself. Instead of eating pizza and ice cream every night, just eat it every once in a while, or something like that. I'm not saying that to completely avoid or change to the extreme. But at least you can start making educated decisions. And that's, again, the purpose of this course. Okay? So this person experienced these disabilities. They've probably experienced some amputations. They're restricted to a wheelchair or walker. They're dependent on others. They're incapable of living independently and functioning independently. Again, they could change their lifestyle and say, I'm just going to, I'm going to try to make the best of this for whatever I have left. Or they can say, I'm already done. Might as well just keep doing what I'm doing and enjoy the rest of the life that I have. And, it's too late now. And they continue on, and eventually they die a premature death. Now, what is premature death in our country? What does that mean? Well, we have to look at the life expectancy in our country. Life expectancy in our country is anywhere between 75 and 80 years of age. Typically, I guess on average, women live longer than men. So, for men, it's about 75 years, and for women, it's about 80 years. So that's what that's the number of years we're expected to live. So when we think about premature death, what does premature death mean? Premature death is dying at 45, at 50, at 60. We're supposed to live 75, 80 years, and we're dying at 45 or at 60. That's premature, and again, you think about, people whether it's people close to you or people who are friends and family of others that you're close to. Someone who has passed away way too soon. They passed away way before 80 years of age. And lots of times they pass away, if they pass away at 50 or 60, they don't look 50 or 60. They look 80 or 90. But in all actuality, they died way too soon. And there's another concept in there that we'll talk about in a second. Actually, it's the quality of years. It's not only losing the number of years of life, according to life expectancy, but it's also having to experience the years of poor quality while you're living. And I'll talk about that in a second. Okay. So that was walking down the illness part of the illness-wellness continuum, and the ultimate point is the premature death. Now let's kind of go back to the neutral point and start walking down the wellness portion of the continuum. And so again, you're at neutral point. You really haven't had a chance up until this point to really start thinking about how you want to, live your life and be committed to a lifestyle that you feel is best for you. Okay, and you see the first point, awareness. That's where this class is coming in. That's how this class is beneficial, is because it makes you aware of issues, and it gives you a chance to say, oh, okay, well, these are the possibilities for things that to happen to me, throughout my lifetime. And these are ways to avoid those things, by engaging in exercise on a frequent basis, by, managing your diet, by engaging in healthy lifestyles, by avoiding negative lifestyle habits. So the more you engage in healthy practices, the more more opportunity you have to live a long and healthy life. Okay, so again, you start to increase awareness. You start to become aware of things. This course specifically will do that. It'll make you aware of certain issues, and then you start to determine for yourself some of the more important issues. Some of the more important things that you want to avoid. Perhaps it's chronic diseases. Perhaps it's mental mental health issues. Whatever it is, and then you become more educated on how to avoid those specific issues. You start to gather more information and become more educated. And eventually, you start to develop a strategy. You start to develop a plan. You start to develop a commitment. And at first, I've talked about the behavior change in my previous video, but it's about, at first it's about changing some ways, or starting a new plan and starting a new strategy to where you're doing things a little different, but that difference is going to help you in the future. Well, that change in behavior at first is challenging. It's difficult, and you'll see that it's hard to change behavior. I mean, you can't just, be a gum chewer and all of a sudden just not chew gum. Whenever you have the urge to chew gum, you want to chew gum, and you're going to stick, you're going to stick a piece of gum in your mouth, and you're going to chew it, but you don't, right now it doesn't seem uncomfortable, but if you ever tried not to chew gum, and whenever you have the urge to chew gum, it's challenging. It's going to be challenging. Now, whenever you realize that you have completed that behavior change is whenever you realize that you no longer have any reason to go back to the way you were. Like if you change your smoking behavior from being an avid smoker or an addicted smoker to I've gone weeks and months without even thinking about a cigarette, then you've changed behavior. Okay, but as long as you're trying to change, you're having to remind yourself, or you're having to resist temptation or resist urges, then the behavior change process is still it still exists. You're still in the process of changing behavior, but it's whenever you complete whenever you've developed an entirely new behavior that you've actually completed that behavior change. Okay, and that's whenever you reach that growth status. So now you are committed to living as healthy a life as you can possibly live. And that's where you start to achieve this high level of wellness. Now, high level of wellness doesn't mean you live forever. In fact, it doesn't even mean that you don't die a premature death. All it means, because we know that happens. I mean, we've known somebody in our lives that we knew was healthy. They were exercising every day. They really watched their diet. They were a happy person. They gave to others. I mean, everything that you can think of as being healthy, they were that, and they still passed away. And all I can say to that is there's still that chance. It can still happen. So this isn't a cause and effect type of situation where you engage in healthy behaviors and the result is you live a long and healthy life. No, that's not the case. What this is it increases the likelihood for living that long and healthy life, and by staying it that way, we know that there's a chance that it may not work out, but at least we're giving ourselves a great chance for it to work out. So whenever we develop a plan for ourselves, a strategy for ourselves, and whatever we decide isn't going to be the same as anyone else. This is an individualistic concept. I mean, only you can decide what's important for you. If you want to be an exerciser, then you exercise. If you don't want to be an exerciser, then don't exercise. Okay? Now, whatever you decide, because even if you exercise, you still have to do other things to maintain a healthy lifestyle. And again, if you don't exercise, you still have to do other things you can still do other things to engage in a healthy lifestyle. All I'm saying is that there's no one fit all, type of one size fits all type of approach. If it's whatever you decide is most important for you, then that's the approach that you're going to take, and it could be, and you can, we could jot down a list of all these behaviors, and we can deem, one is unhealthy and another, if we took like one of those behaviors and we said, if we do this, this is healthy, and we did this, this is unhealthy, then, we just have to decide, okay, for this particular behavior, I'm going to be healthy about it, and that's going to be my approach. And another behavior, you can say, yeah, it's not that important to me, and it's not that important to you. It doesn't matter. But for somebody else, it might be the number one on their list. So what I'm saying is that the way that you approach your optimal level of health is all up to you. No one can tell you how to do this. Not even me. I'm not going to do that. Okay? All my job is to make you aware of issues and allow you to decide, how you want to approach your habits or your lifestyle choices in order to accommodate all of the possible issues that you may experience in your lifetime. Okay? And that's all this is, okay? So the illness wellness continuum, and you can see again looking at the paradigms, the wellness paradigm compared to the treatment paradigm or the medical paradigm. Medical paradigm just tries to get you back to where you were. The wellness paradigm gives you a chance to really optimize your level of wellness or your level of health throughout an entire lifetime, and that's by being proactive and being more engaged in your lifestyle than just saying, what, I had a heart attack, I'm going to take some medicine and then my heart will be fine again, or I'm going to get surgery and my heart's going to be fine again. That's really the difference. And a lot of people, they live the treatment paradigm where, they don't care about health. They just want to make sure that they're covered. And sometimes it works, sometimes it doesn't. So, that's a risk that they're, I guess, willing to take. All right, so here's another slide dealing with the illness-wellness continuum. Again, you have the two endpoints. This side is irreversible damage, which is pretty much disability. And on the other end, you have the optimal wellness, which is what we've discussed. This is another slide that kind of demonstrates, our opportunity to engage in or decide on healthy and unhealthy lifestyles. So if you look at the two graphs, you can see that from 0 to 20, they're about the same. All right, so you can see the green line. You can see that this is a low, medium, high, and then death. What the low, medium, and high are referring to is morbidity. And for those of you who've never heard the term morbidity, that's one of the two ways that we can assess health in this country. We assess it through morbidity, and the second is mortality. So what we're saying is, how does diabetes, let's say for example, affect you? And you can say it doesn't affect me at all. That's low level of morbidity. That's low. That's a very low a low state or low status of being affected by diabetes. It's so low that it doesn't affect you at all. But to some people, diabetes has a high level of morbidity, meaning they're so affected by diabetes that it consumes their life. Perhaps they've had amputations. Perhaps they're in a wheelchair. Perhaps they're dependent on others. They've lost their independence. That's a high level of morbidity. Now, the ultimate level of morbidity is death, is mortality. Diabetes consumed you so much that it actually killed you. Okay, So morbidity is the level of or is a state of how the disease or a state of being affected by the disease. Mortality is the disease killed you. Okay, so you can see that on both charts, you start with a low level of morbidity and you end with death. Okay, and also in both charts, death occurs at 80 years of age. Hopefully you guys can see that. So death occurs at 80 years of age. Okay, so in both charts, we're looking at someone who survived from 0 to 80 years of age, one who lived an unhealthy life, and the other one who lived a healthy life. Okay, so going back to the example I just gave, so for the first 18 to 24 years of life, you're really at neutral. You haven't really had a chance to experience any adverse health conditions, but at the same time, you haven't really had a chance to engage in a healthy lifestyle approach. All right. So you take that first person who engaged in nothing but negative lifestyle habits, and again, let's be extreme and just talk about the entire gamut of unhealthy lifestyle or unhealthy habits. They decide to engage in those, and it starts to affect them. By the time they're 40, let's say the doctor says, hey, you're showing signs of diabetes, or your cholesterol's really high, or blood pressure's really high. And, no worry about it. I'm just going to keep doing what I'm doing. By the time they're 60, they've had amputations. They're in a wheelchair. They're independent, and you can see for the next 20 years of their life, they're pretty much living in misery. They're like, man, I'm having to go to the doctor a lot. I'm having to take all these medications. Nothing's working. My life is miserable. And then eventually, they just kind of pass away. They die. And, whenever you look at that, you're kind of thinking, you know what? You actually have been dying for, 20, 40, 60 years. You really didn't ever have a chance to live a healthy life. It's just been a slow, gradual death. Whereas the other person who decided to, and again, let's be extreme, decided to engage in nothing but positive lifestyle habits. And again, you can tell me, all the entire gamut of positive lifestyle habits. But again, it's individualistic. It's important to you. Whatever it is that you want to do, that's what you decide to do. Okay? So this person decided to engage in nothing but positive lifestyle habits, and for, almost their entire life, they never really experienced anything negative. Nothing really affected them. They would go to the doctor regularly. The doctor would say, hey, all your numbers look good. Your body's fine. You feel fine. You look good. Everything's fine. Just come see me again in a year just to make sure everything's, working well. And, they spend their entire life, not really being affected by anything. They're not really affected by diabetes, heart disease, cancers, nothing. They're just, but they've given themselves that chance because they've engaged in positive lifestyle habits for an entire lifetime. They've never done anything that's going to affect their health, or at least they've never done anything on a long-term basis that affects their health. Now, like I said, if you eat ice cream one night, out of the blue, nothing's going to happen. But if you eat ice cream every night for 60 years, I assure you, that ice cream is going to have an effect on your health. I promise you. All right? So I'm not saying to avoid everything, entirely, but just minimize or moderate the times that you do engage in negative lifestyle behaviors. But anyways, so this person lives to the same age at 80 years old, but this person was, at this time, but they both lived to 80. This person over here, perhaps, they're out on a morning walk and, it was just their time to go. And they just pass away. And, I don't mean to mock death at all, but, it was a slow, it was a quick, painless death. It was their time to go. They fell, they passed, and it was done. Whereas this other person lived that death for, a good 40 years or so. This person died instantly. And that was it. They lived a long, healthy life. They were happy. But it was just their time to go. Everybody has to pass away. I mean, no one lives forever. I wish we did, but no one does. So whenever you think of it this way, like, which way would you rather go? Are you wanting to live a long, slow, miserable death, or hey, it's my time to go. Let's do this, quickly. And so I mean, there's only two options, right? All right, so that's that's where we are with this class. So this class is going to help you identify issues that you may face, and it's going to give you a chance to engage in behaviors that will try to optimize your level of health for an entire lifetime. Okay. So here is the so here's a chart or a graph. An image showing life expectancy, and you have life expectancy, which are the blue columns, and then you have healthy life expectancy, which are the green columns. Okay, so you can see for males are expected to live about 75.6 years, but they're also expected to experience 65 of those years as healthy life. In other words, high quality of life. So for the last 10 years of their life, that's whenever they start to experience some, adverse health conditions, or morbidity, going, with the term that we used in a couple of slides ago. And for women, you can see, life expectancy is over 80 years, and their healthy life expectancy is about 67 years. So really what we're trying to do, and if you imagine someone who is, let's say, dies prematurely, or that's a different. Let's say they're going to live to 75 years, but they get an amputation at 44. Now they're in a wheelchair at 44, but yet they still live to 75. I mean, that's about 30 years of lost life expectancy. So really what we're trying to do is we're trying to minimize the gap between healthy life expectancy and life expectancy. So pretty much we're trying to live as healthy a life as close to death as possible. Okay, and that's again what this class is designed to allow you to do. Okay. Here's some information on leading causes of death. You can see that heart disease is the #1 killer, about roughly 24 to 25%. Cancer kills a lot of people as well. And then you have some individual diseases, and I mean they're frequent. I mean, they're not as common as cancer and heart attack. I mean, we'll talk about heart attack or heart disease and cancer throughout the semester. We'll talk briefly of lung disease. We'll talk about strokes. We don't really talk about accidents, which we should, because it's the leading cause of death among your age group. But we'll talk about some of these issues, or a lot of these issues throughout the semester. But that's pretty much the reasons why, half the reason why people pass away are either heart disease or through cancer. Oh yeah, so here are your leading causes of death among your age group. Now I know you're older than 15, but that's according to the CDC, they group you into 15 to 24 years of age. So leading cause of death among your age group are the accidents, followed by homicide and suicide, and then some other health conditions. But like I said earlier, you haven't really lived long enough to develop lifelong or chronic diseases like heart disease, cancer, and diabetes. Okay, so so when we look at some of the things that you experience, I mean, right now, accidents, you don't have any control over accidents, and lots of times not even over, homicide, and some would even argue over suicide. But when we look at some of the things that affect your health, affect your life, perhaps you haven't experienced heart disease just yet, or any other cardiovascular disease, but perhaps you're still not feeling as healthy as you possibly could. And some of these issues, and especially as college students, especially as poor college students who have to work and assume so many different responsibilities, you might, start to look at this chart and say, you know what, I experience a lot of this. I'm stressed out all the time. I don't sleep very well. I'm always tired. always anxious about, what's about to happen. I get sick a lot. I mean, there's, I have mood swings. I mean, there's different things that you may be experiencing, that's not necessarily a chronic disease, but it's actually affecting your health right now. All right, so when you start to think about this, and this is where we're getting at with this behavior change project, you can start to look at, you know what? I don't want to experience this anymore. I want to try to fix this. I want to try to change this so that I don't have to experience, sleep difficulties or depression or, anxiety anymore. Okay, so, this is where you can start thinking about your behavior change. Now, when we talk about wellness, we talk, again, we're talking about an approach. We're talking about a strategy. It's not just about, okay, I'm going to go to the gym every day. Because going to the gym is great. But it's only captured in one of the dimensions. And I'll talk about physical wellness in a second. But what we're trying to get you to do is start thinking about everything in your life. All right. So you're talking about your physical wellness. Then we start talking about like your relationships with your friends and your family. Now we're getting into social wellness or emotional wellness. We're talking about your grades and your study habits and how it affects your stress levels or your emotions. I mean, so that's intellectual wellness. Going into other we have all these aspects, and we break them down in this course to the 6 dimensions of wellness. And if we looked at another textbook, there could actually be 7 dimensions of wellness. But for this class, with the textbook we use, we break these down into the 6 dimensions of wellness. And here you can see that they're physical, social, intellectual, emotional, spiritual, and environmental. And as we go through these dimensions, again, these are opportunities for you to look at different aspects of these dimensions and say, you know what, that's something I'd like to change. That's going to be my behavior change project. Okay. All right. So physical wellness, it encompasses all aspects of a sound body, including body size, shape, and composition, body functioning, strength, flexibility, endurance, sensory sharpness and responsiveness, resistance to disease and disorders, ability to recuperate. You can see the list. Okay, so a lot of people will associate health with fitness, and fitness is important. Don't get me wrong. Being fit does allow you to experience certain aspects of an optimal level of wellness, but it's not everything. And again, if you choose not to engage in exercise, it doesn't mean you're not healthy. You just have to find ways to make yourself healthy in other dimensions. Okay. Going to the doctor is important, and this is part of physical wellness. Getting your checkups, your dental work, your medical checkups. Just because even though you don't feel unhealthy or feel like you're experiencing any problems, if they identify, if they do a blood test and they find an enzyme that's only present if cancer is present in your body, well then you've identified cancer. You've tested. Now you just need to do some additional tests to locate exactly where it is. But if you didn't go to that medical checkup, then you wouldn't have found cancer. And by the time they did find cancer, it may be too late. So it's important to go to these checkups. Same thing with dental checkups. Okay. Social wellness. Social wellness, you can see here, being able to have satisfying interpersonal relationships and maintain social connectedness. This is capturing your relationships with not only with yourself, first and foremost, but also with your friends, family, people you associate with. Capturing it's your communication skills, your interpersonal skills, how you treat others, how you express yourself to others. And if you really start to think about it, I mean, there's a lot of issues. You may not realize, but you're mean or you're snappy, or you're snippy at others. Sometimes sarcasm comes into play, and sarcasm can be good in enhancing or promoting humor, but at the same time, It could also promote, rudeness as well. So, if you start to reflect on some of your, communication practices, then you can start to say, you know what, that might be something I can change. Maybe I want to start treating everybody well, or maybe I want to, maybe I want to make sure that, everyone that everyone thinks of me as a nice person. Or, I mean, these may sound corny to you, but for someone who reflects and they realize that there's some disconnectedness, then this might be an opportunity for them to change their ways, change their behaviors. Intellectual wellness, to engage in new and ongoing learning opportunities. It captures creativity, knowledge, expertise, exploration, ambitions, challenges. I mean, by being in college, by nature of being in college, you're already, engaged in this intellectual wellness, or trying to enhance your intellectual wellness. But does it end there, or is that all that you need to do? What happens when you graduate? I mean, how are you going to continue on? So again, there's lots of opportunities to change a behavior and it's one of it captures this particular dimension, intellectual wellness. Emotional wellness, it's the ability to control your emotions, express them appropriately at the right times. This is where coping skills come into play. There is a difference between the social wellness and the emotional wellness, and that in social wellness you have the ability to express feelings. But here, you're understanding how you cope with different situations. So, perhaps, like sometimes, if you think about like kids, they get called a name and they go home crying, they haven't had a chance to develop their coping mechanisms. Whereas, you guys as adults, somebody calls your name, you're just like, all right, whatever. It's not going to bother me. I have a lot more to live for, and I have a lot more to worry about. So it's the ability to develop some strong coping skills, trying to identify sources of negative stress and trying to avoid them. It's an opportunity for you to enhance your self-esteem or your sense of autonomy, your sense of independence, and a lot of that has to do with how you can defend yourself against, attacks or emotional distress. Okay. Spiritual wellness, the sense of inner peace, satisfaction, and confidence. This is where meaning of life comes into play. Your morals, values, your ethics. The things that you feel are most important to you. How do you maintain? How do you capture? A sense of that of that dimension of wellness. And religion and prayer comes into play. Meditation, a sense of unity and camaraderie. How do you protect? Your relationships, or your close relationships with others, with loyalty. Environmental wellness, an appreciation of how the environment can positively or negatively affect you, and the role that you play in preserving, protecting, and improving it. Now, a lot of people, whenever they hear environment, they'll think of air, land, and water, which it is captured in this dimension of wellness. But it's also the environment that surrounds you, whether it's at home, whether it's in your apartment, whether it's in your team or your class. How like the setting that you're in, how does it affect you? Is it affecting you the way that you want it to be affected, or are there things that are happening that you can fix to make yourself feel better? Okay, so that's all captured in environmental wellness. Okay, so in order to be well, according to this course and according to our textbook, it's important to enhance all dimensions of wellness. So it's an opportunity for you to look at each of these dimensions and start to realize, there's some things that I can do here, or there's some things that I haven't done here, or maybe I'm doing too much here. Maybe I should, kind of redistribute my focus to making sure that, I'm capturing, portions of all dimensions, because in all actuality, we can't really be self-actualized until we really take care of everything about ourselves. And that's what this diagram is showing. Now, this is Maslow's hierarchy of needs. And the only reason I put this here is just so that you can see, get a sense of what self-actualization really means. Now, according to Maslow, in order to achieve self-actualization, you have to achieve the basic or the more basic levels of needs first. So starting with basic physiological integrity. As long as you're achieving all of these, then you can start securing the next level, which is safety and security. And then if all of these, these components are taken care of, then you can become capable of experiencing the next one, which is belonging and love. But in any of these components, like, for example, sleep, if you're not sleeping, then it's hard for you to, to achieve basic physiological integrity. And if you're not experiencing basic physiological integrity, then it's hard for you to be safe and secure, because if you're not sleeping, and because of it, let's say your blood pressure is increasing, then you're not safe. I mean, you're going to experience a bad, health condition eventually. And so in other words, that's what this whole diagram is saying. But the point that I want to get to is this highest portion, which is self-actualization or self-fulfillment. At this point, this is whenever you can look back and, look at everything about you and all the things in your life, and you can say, you know what? I would do everything the same. If I had to do it all over again, I would do it exactly the same way. I would. Or, you can say, you know what? I kind of regret doing it this way, so if I do it again, I would change that. So, this is an opportunity for you to reflect on yourself. Again, we're trying to identify a behavior you'd like to change. I think all of us probably will think that we're all perfect, but in all actuality, we're not. That's just the way it is. We can think of things. Now, you may be proud of the things that you do to try to optimize your level of health. But I'm sure you can still find something. And if you have trouble, then just email me and we'll talk about it. All right. So start thinking about your behaviors. Okay. So these next couple of slides are just kind of ideas of how you can engage in a high level of health or a high level of wellness. And again, you're responsible for your own health, and what you do is going to be different from everyone else. I promise you. It's about you, and it's about taking an active approach on your level of wellness. Meaning, you decide, what you want to do in order to prevent any adverse health conditions, and you just simply stay committed to it. So in other words, taking an active approach is you're preventing, whereas if you took a reactive approach, you'd be waiting for something to happen before you finally did something about it. And that's like where surgery would come into place. Well, I could have avoided a heart attack, or I could say, you know what, if I get a heart attack, I'll just have surgery. So there's a difference. Okay. All right. So our behavior change project, you have the contract. Behavior change, well, let's say behavior change contract, not project. And then we'll have 2 progress reports, and then you have your video presentation at the end of the semester. Okay. So I'm going to talk about the trans-theoretical model real quickly. And this is just to help you with the behavior change project. Okay. So when we look at the trans-theoretical model, this is a model that allows us to understand the process of a behavior change. And the first step you can see is pre-contemplation. Okay, and what this is saying is pre-contemplation is before you even think about change of behavior. It's before you even realize that you have a behavior that you need to change or you would like to change. It's the smoker who doesn't realize that smoking is bad for you. Now, a lot of us would kind of don't believe that actually exists, but yeah, there's people that they don't even realize that smoking is bad for you, and whenever you tell them and they come to that realization, it's like, oh, it's bad for me? I didn't know that. Now they've gone from pre-contemplation to contemplation. Now they're at a point where, yeah, maybe I should consider changing. Maybe I should think about, stopping my smoking habit. That they're thinking about it. And if they decide, no, you know what? I'm fine. I'm not going to change. Well, the behavior change is done. Like, the behavior change is terminated. There's no behavior change. But if they decide, you know what? I think I'm going to change. I think I'm going to quit. Now that I know that it's bad for me, I think I'm going to quit. I think I'm going to quit. So they've decided that they're going to quit. So now they're engaged in a behavior change. Now, the next step of that behavior change, now that they've decided to quit, is how are they going to quit? What is going to be their strategy? Are they going to say, you know what, I'm going to do this cold turkey, and just every time I'm tempted, I'm just going to tell myself, no, 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 no? Are they going to go buy the patches and put patches on their bodies until, finally they get to the point where they don't need them anymore? Are they going to chew the gum? Are they going to go to classes? What is their plan? How are they preparing for this behavior change? Because we have to have a preparation. We have to have a plan. We can't just say we're just going to do it and not do it. I mean, we have to have a plan. Now, whenever you put this plan into action, or whenever you start implementing this plan, that's the next step. Now you're in the action phase of a behavior change project. You're actively trying to change. And at first it may be very challenging because you're tempted to revert to your old behaviors. And by the way, if you do revert, we call that relapse. And you can see, according to the diagram, you can relapse all the way to contemplation, but you can't go back to pre-contemplation. You can't go back to the point where you don't realize that behavior is bad for you. I mean, you can only go back to contemplation. You can say, you know what, I know smoking is bad for me, and I've tried to change. I just can't change. There's nothing I can do about it now. Behavior change is over. I mean, you know that it's bad for you, but you can't do anything about it. Behavior change is over. Or you can say, you know what, I'm going to give it another try. And then you can go back down the line of preparation and action. And again, whenever you're in action, I mean, you're attempting to change the behavior. You're attempting to become a non-smoker. And every day it becomes easier to the point where, it could be days, it could be weeks, it could be years. But you get to the point where you never think about smoking a cigarette. And if you're a non-smoker, then you know what that feels like. You know how that is. Like, I'll be honest with you, I've never smoked a cigarette before in my life, and I never think about it because I'm not a smoker. You know what I'm saying? That's what I'm saying. Now, I'm not saying I'm better than you. If you're a smoker, I'm not saying I'm better than you. I mean, if you're a smoker, then you're a smoker. I mean, I'm not a smoker, so it doesn't mean I'm better or worse. It just means that I'm not a smoker and you're a smoker. That's all that matters. I mean, that's all it means. But what I'm saying is that as a non-smoker, I've never thought about smoking a cigarette. And smokers, I mean, I don't even know if they don't even think about smoking cigarettes. They just do it because that's who they are. That's their behavior. But whenever you try to stop smoking from the time you stop smoking, or you try to stop smoking to the time you just no longer smoke, then that's the action phase. That's the action portion of the behavior change. Now, when you get to the point where you are maintaining a new behavior, then the behavior change is over. You have maintained the new behavior. This is also known as the termination phases, whenever you've terminated the behavior change. Okay, so that's the trans-theoretical model. So whenever we think about the behavior change that you're about to engage in, this is where we are. You're in pre-contemplation right now, where you're not realizing that you want to change anything. But once you identify something, then you're going to be in contemplation mode. Then you're going to start developing a strategy, which is why we have the behavior change project, or the contract. You start developing a strategy, an award system. This is my effort. As long as I keep pushing, I'll be rewarding myself until the point where I finally have changed my behavior, and you are a new person. You are something different. You're no longer sedentary. You're no longer an exerciser. You're no longer a dieter. Whatever it is that you're trying to change. Okay? All right, so that's the trans-theoretical model. These are SMART objectives. I'm not going to worry about this now. I mean, part of your behavior change contract says that they need to be SMART. I'm not going to be concerned about it. You can go through the notes and look at what the SMART principle really means. It's an acronym. You can see there. You can see from this slide. There's a school of thought that says that the SMART principle stands for specific, measurable, achievable, relevant, and time bound. The other school of thought says it's specific, measurable, appropriate, realistic, and time bound. There's some slight differences, but really the achievable and the realistic portions are the same, and the relevant and the appropriate are the same. Just again, different change of schools of thought. But whenever so for what the SMART principle is used for is whenever people develop goals and objectives, and it's more important in other courses, but not necessarily in this class. In order to help them develop a sound, a strong objective or a strong goal, they apply these principles and they make sure that their goals and objectives, it's specific to what they're trying to achieve. It's measurable in the sense that if I do this, then this is what I'll experience. It's achievable or realistic in the sense that it's not impossible. It's challenging, but it's reachable. It's achievable. It's realistic. It's relevant or appropriate in the sense that if I do this, then it'll help me, achieve what the ultimate goal is, or what the ultimate vision is, or whatever it is. And then it's time bound in the sense that I'm trying to achieve this by a certain time, by week 2, or by March 30th, or whatever it is. All right, so that's what the SMART principle is saying. Yeah, so you can see that these are just, you can go through this if you want to. You don't really have to. Okay. Well, normally I do a group activity, but this isn't an in-class course, so we don't have a group activity for now. But hopefully this chapter helps you with identifying the behavior you want to change. Remember, you have your behavior change project, our contract due on Sunday night, as well as your student video introduction. Okay. So in order to submit your behavior change, you go to the assignments tab and you go to the behavior change contract, and so I have a file there you can download. I'm sorry, download that. You complete it. It's a Word document. You just fill in the blanks, fill in the boxes, save it to your computer, and then you click on the title of the assignment, and then you have your attach a file, and you browse your computer. And you look at you just attach your file, submit it, and it comes to me and I'll grade it. Okay? Alright, that's it for Chapter 1. I will post Chapter 2 video soon. Alright, you guys have a good night.